Hi, my name is Jessica Farrell. I'm a clinical pharmacist at Albany Med Division of Rheumatology and professor in the Department of Pharmacy Practice at Albany College of Pharmacy and Health Sciences. I've been in rheumatology for about 15 years, and I'm excited to be here today to talk to you about Voclosporin. The question that I'm answering today is, what are the clinically meaningful differences between Voclosporin and other calcineurin inhibitors? So let's talk about Voclosporin and calcineurin inhibitors in general. So Voclosporin is considered a second-generation calcineurin inhibitor that is FDA approved for the treatment of lupus nephritis. As with other calcineurin inhibitors, Voclosporin works by decreasing lymphocyte proliferation, blocking T-cell-mediated immune responses, and increasing the podocyte integrity in the kidney. Voclosporin is structurally similar to cyclosporine, but it does contain this modification of a functional group on the amino acid 1 residue that increases the calcineurin binding activity, which results in 3 to 5 times increased potency compared to cyclosporine. This modification also allows for faster elimination, therefore a more stable pharmacokinetic profile, and the oral bioavailability is more consistent. So unlike other calcineurin inhibitors like cyclosporine and Tacrolimus, we don't need to do routine drug monitoring with Voclosporin. Also, one other difference is related to drug interactions. So there is some data to support that cyclosporine can decrease concentrations of the active metabolite of mycophenolic acid. So for patients that are on Cellcept or mycophenolic mofetil, that there is this drug interaction where there could be decreased efficacy, but that doesn't exist with Voclosporin. The other concern with mycophenolate and tacrolimus is that mycophenolate can increase the serum concentration of tacrolimus. So again, the need for more therapeutic drug levels and monitoring when patients are on both, which is generally the case. From a safety perspective, while Voclosporin is similar to other calcineurin inhibitors in terms of monitoring, there appears to be less incidence of hyperkalemia compared to the other calcineurin inhibitors, but we do still need to monitor potassium. And the other benefit that Voclosporin has is that it appears to have less of an effect on the lipid profile and glucose profiles, so less incidence of diabetes associated with Voclosporin compared to some of the other calcineurin inhibitors. In a patient population that this may be relevant for, in our young patient population, when pregnancy is a possibility, tacrolimus can be used in pregnancy. Unfortunately, Voclosporin cannot. The ACR guidelines do say to use other agents as opposed to Voclosporin at this time. So continued long-term safety data and possibly comparator trials between the different calcineurin inhibitors in the future would help solidify these differences. But I think this is a good start, and Voclosporin is a treatment option for our patients with lupus nephritis. If you want more information about Voclosporin, about lupus nephritis, about anything rheumatology, please go to our RhAPP website or our RhAPP ACE app and browse some of our educational content. Thank you.